Welcome to Cradle and All, a podcast hosted by sisters Renita and Christine to educate, inspire, and connect with other mothers. Every other week, listen as we discuss topics related to pregnancy, raising children, and balancing motherhood with other aspects of womanhood. Whether you're relaxing, juggling tasks, or even breast pumping, join us as we figure it out together. Hey, you guys. Welcome back to another episode of Cradle and All. Welcome, Christine.
Hi. How are you doing?
Good. So today we're going to be talking about all things pregnancy body. So, Christine, how did you find out you were pregnant?
Oh, man. So I have been pregnant 3 times. I have 2 beautiful children. One was unfortunately a miscarriage. And so each time I had the feeling that I was pregnant. For every pregnancy, it was always that feeling of like, something's different. With Dallas, I feel like I knew way before I took that test. I literally was counting down until my missed period to take the test.
Oh my gosh.
Yes, I literally had a feeling. It was just a gut feeling like I'm pregnant. So I remember like 2 weeks before, every night I'd be Googling symptoms of pregnancy every night, looking it up, being like, okay, do I have this? Do I have that? I didn't really have any symptoms. Well, oh goodness. Yeah, I don't believe I had any symptoms, but I just had that feeling that I was pregnant. That was the only symptom, was intuition. I knew something was up. So the day of my missed period, I took a test and I was pregnant. And I was like, I knew it. I knew I was pregnant. So yeah, that was that one. I wasn't even trying. It just happened. I wanted it to happen and it did. And I was also engaged, about to be married in 6 months. So that's a whole nother story. And with Dakota, I was trying to get pregnant with him. We wanted a second child around the 2 years after Dallas. And so with him, again, I wanted it. So I kept being very mindful of all the symptoms. And I knew my period was late by like 2 days, because back then it was like clockwork. One of the changes with pregnancy is that now it's not like that, but it used to be like clockwork. And so I took a test and I was pregnant. So each time it was just me being aware. With the miscarriage, I actually did not know. I was like a month late. And I was like, wait a minute. I looked it up. I'm like, wait, I'm having pregnancy symptoms. Am I pregnant? Took the test. Oh no. Well, I was not excited. I wasn't ready then. And I was like, oh, I am pregnant. So yeah, each very different, but I think my intuition game is strong because I always kind of have these inklings. So what about you?
So interesting. It was very different for me. So with Jackson, we were trying for a few months, and every month I'd be like, this is it. I feel it. I got bloating. I have breast tenderness. I think I'm nauseous. And then my period would come and I'd be like, oh man. So this was like 3 or 4 months in. The same thing kept happening. I was so defeated. And so the 1 month I was like, well, I have cramps. So I guess here comes a period. I was like sitting on the couch drinking wine with Bryson. And I was like, well, I guess I can have this glass of wine. I'm about to have my period. I've been cramping all day. And we're packing to go to Hawaii. And so as I'm getting all my toiletries together, I see this last pregnancy beneath the sink. And something in me was like, well, I guess I should just take this for one last try before I throw this out. There's no point. And I took it and it turned positive. And I was like, what?
Yes.
So then I called Bryson. I was like, look. And he looks at it and he didn't even say a word. He ran out the house without saying anything. And I was like, where did he go? And he went to the CVS across the street and came back with like 6 more.
Oh my gosh, that sounds like something you would do.
Literally, that's how we found out that we were pregnant. So that just goes to say I do not have great intuition, because every month I thought I was pregnant because of some quote unquote symptoms. I actually was not. And the 1 month I had no symptoms except what I thought was menstrual cramps, I ended up being pregnant.
We can really convince ourselves of anything. It's like, oh, this is what this means. It's like, no, it doesn't. I just want it to mean that.
I know. But it's just so funny because that was to me the introduction of the changes my body felt in pregnancy because I had expectations and then there was reality. So let's get into it. What was it like for you when it came to what you felt like in the first trimester? What were some of the first changes that you noticed about your body?
Mm-hmm. With each pregnancy, it was different. With one pregnancy, I had really horrible breast tenderness, and that was one of the first symptoms. I remember not nearly as bad as yours. You told me how bad yours were. Mine was not that bad, but actually something that was really odd that I totally did not expect was pain in my uterus. I had like I remember talking to you about this because I was like, why am I having this horrible cramping? And it was like the ovary was, I had a cyst on it. Yeah. I had a cyst on my ovary, and that was causing me pain almost the entire first trimester. It was so painful. And it wasn't just, it peaked, the pain peaked, and then there were valleys, but it was pretty consistent daily that I was having a pain. And I was just waiting because you kept telling me, oh, the swelling will go down. That's the ovary that the egg came from that ended up being my baby. But I did not expect that at all. I didn't expect any uterine type of pain. I thought, great, I don't have to have any uterine pain for the next 9 months because I'm going to have a baby in me. But no, that was really unexpected and awkward. And it actually made me very nervous because I was like, is everything okay? Why am I having this cramping?
Yeah, that's so interesting. So, what she's referring to is she had a cyst on her ovary called the corpus luteal cyst. Basically, that's the cyst that you have that maintains the pregnancy for the first few months, first few weeks until the placenta takes over. And hers was pretty large and it was leading to a little bit of extra pain and cramping. I also mentioned that I had some cramping, and it actually can be quite normal for women to get some cramping or mild abdominal pain in the beginning of pregnancy. So, both of those very normal things, but can be really nerve wracking when you're like, wait, what's going on?
Does everyone get that cyst?
Everyone has it to an extent. Yours was just on the larger side. Like yours was abnormally large, but everyone has that cyst in order for the pregnancy to be maintained.
Wow. So it was abnormal. That is just great.
Now, my breast tenderness was out of this world. Like literally, once I got my positive pregnancy test, I started to get symptoms about 2 weeks later. And the first symptom was breast tenderness. I literally could not sleep on my stomach because it would hurt too bad. I felt so uncomfortable wearing a swimsuit when we were on our trip in Hawaii because it was so uncomfortable. Like it was intense. I was like, what in the world?
Yeah, that is wild. I was so shocked by how painful yours was because I was like, that seems abnormal to me. That much pain. I guess everyone's tolerance is different. And also the amount of tenderness you get is probably different as well. You also experience bloating, which I don't think I ever really got.
Oh my gosh. Bloating so early in the pregnancy. Also, this is funny looking back, but before I knew I was pregnant, I was trying on all these outfits to go on this trip to Hawaii, and I purchased new outfits 2 weeks before. And then by the time I tried the outfits on, I was like, why don't I fit into these? This doesn't make any sense. And my bloating had started from the beginning. I literally already looked like I was pregnant when I got my positive pregnancy test. And then with Russell, it was even worse. Somebody told me that I looked pregnant, and I was only like 12 weeks pregnant by that point. So
wow.
It was insane how much bloating I had, which again can be a very normal thing in the beginning, but it makes you feel that from the beginning.
I remember wanting to look pregnant. I remember my cousin was also pregnant at the same time as me. I remember sending her a picture the day I felt like I was finally showing. I went in the bathroom. I was like, look, I think I was in the 20s at that point, like 20 something weeks. I was like, look, my stomach. Maybe 16.
I was so like, I had a stomach at, as I said, 12 weeks.
Well, this was with my first pregnancy. Back, the first one, everything was still tight back then. So nothing was showing yet. Everything had abs, I think, before the baby came. So yeah, I was like, I wanted that look. I wanted people to look at me and say, oh, are you pregnant? How far? Well, I didn't want to ask that, but I wanted them to say, you look really great. How far along are you? And I didn't get that until the second trimester.
That's true. Like some people may show early on, early second trimester, and some people can be later on. Like when I look at pictures of you from your wedding, I'm like, you barely can tell you're pregnant and you were 22 weeks.
Exactly. I mean, that probably was subconsciously because I knew I was going to have to fit into a skin tight wedding dress without alteration. So I probably made that happen. But yeah, that's true. I think part of it is probably genetics as well, because even with my second son, I feel like I didn't gain a lot of weight. The weight came after, but I carried very small, whereas some other people, that's not the case for them.
Yeah. Now, outside of looks, there's other feelings that you can get in the first trimester, like obviously nausea for some people. I actually didn't get that in the first trimester with Jackson, only in the second pregnancy.
Mm-hmm.
And I can't remember, did you get nausea?
I did actually. I got it in the first trimester. It wasn't the horrible morning sickness that you see in the movies, but it was enough to where if I did not eat a pretty substantial meal, then I got really nauseous. So I could never skip meals. I could never wait too long to eat because if I did, then I would feel really, really sick to the point where I needed to lay down or just, eat something very quickly. That's when it came on for me. And I feel like the same was for you as well. Like you had to, with Russell particularly, you had to be on top of your meals.
Yeah, I basically had to eat every 2 hours for the most part, or I would just feel so nauseous,
Mhm.
but
Yeah,
never throwing up. Like that's the thing. The vomiting wasn't there, just that nauseous feeling, which makes you feel disgusting all day.
it does. I remember getting nauseous and throwing up with my very first pregnancy, the one that resulted in a miscarriage. I remember I was cleaning the kitchen and the smell of the cleaning products made me so nauseous. I threw up. But that was really the only time in all of my pregnancies that I threw up and got sick. But I remember something you told me once, you threw up in the car. You had like a
Yes.
bag. What
I
pregnancy was
was
that for?
That's with Jackson. I literally was just driving home from one random thing, no nausea at all, but suddenly I felt like I had to throw up, and I just pulled over on the side of the road and threw up on the sidewalk. It was so disgusting. And I was like, where did this come from? I was like, welcome to pregnancy.
Random.
Yeah.
So why do women experience nausea in pregnancy?
Now, it's thought that it's related to the pregnancy hormone HCG, the high levels of it, and even some of the high levels of estrogen that probably leads to it. So anyone can get it. But that being said, some people don't have it at all. The other thing, too, is for women who have higher levels of HCG, like women who have twins, so double the fun, so to speak, of those levels, you might be more prone to getting it, too. Now, there is a myth that it is related to gender, but that is not
Mhm.
true. Trust me, because obviously I've seen it at work. But I thought when I had nausea in the second pregnancy that Russell was going to be a girl, and boy, was I wrong. But
Something else they say that is linked to gender is your skin, which I actually think this is quite problematic because they say that if you're having a boy, you're going to be glowing and dewy and have beautiful skin during your pregnancy. And a girl, they say, sucks all the beauty from you and leaves you with
false,
bad skin.
false. Then why do my boys make me have so much acne?
That's why they said it's just, it's a wives' tale. But
Exactly.
so you had skin issues during pregnancy also?
Yes, it's the craziest thing. Now, I've always had some level of acne my whole life, but usually just to my face. Luckily, that can be controlled with products. However, once I'm pregnant, I get the worst acne on my back, and it's like nothing helps. And so the whole pregnancy, I'm just broken out on my back with like these big cystic acne nodules. And then it leads to dark marks that I have to deal with after the pregnancy. So that's something that I experienced.
Mm.
Though as soon as the pregnancy's over, it's like the acne itself goes away. What about
Wow,
you?
that sounds like a lot. I actually had really great skin with my pregnancies. That is one of my favorite things is the skin was just so clear. And of course, you're not tired at that point. So no dark circles, everything. Well, you can be in the third trimester, I was, but in the first trimester and second, I was just felt like my skin was just on point, except with Dallas, my firstborn. I had chest knee, like it came up out of nowhere, which is, I guess, chest acne. And it was really bothersome because, like I said, I was getting married and my dress had a really deep V because of course my boobs look really good. That's another thing about pregnancy that was awesome, is that I had really great boobs and they were showing off in the dress, but my chest was really bad. So I remember having makeup on my chest, and I told Dontrell during the ceremony, during our photos and everything, I'm like, don't touch my chest because there's makeup on it. Because like you said, there were dark circles and it was so bad. I was so mad about that. I'm like, of all the things, I've had clear skin my whole life, but now I have acne on my chest and it's showing for the whole world to see. So that was really the extent of it. I didn't get, and I also, I think I also got like some dark lines around my neck, which I don't remember what's that's called.
Melanasma.
Yep.
Yeah. So that's another fun thing that I got too. So basically in pregnancy, for those pregnant ladies out there who've been pregnant, you might remember you get that dark line that goes up from your belly button down to like your pubic bone.
Yep. I still have one.
Yes. So that darkening is normal because the estrogen levels can lead to some of that. But you can get melanasma where you get dark patches in other areas. So Christine just mentioned it around like her neck. I got it like under my armpits and around all these random places. So these random dark areas that just look strange.
Mm-hmm.
Some people can even get it on their face. And it's not always guaranteed to go away. For most women, it does, but sometimes it can just be permanent.
Wow. So like that line on my stomach that's still there, that may never go away.
No, that should go away, but sometimes it can take a few months. Like mine didn't go away until my kids were about 8 to 9 months.
Okay, great. So mine should be going away soon.
Yeah. Now, you mentioned a second ago that you only had fatigue in the third trimester. I had intense fatigue in the first trimester. Like, I feel like I'm not somebody who typically naps, but when I'm pregnant, all I want to do is sleep all day long. Just sleep on that couch. Bryson literally would be like, you'd come home from work, take a nap, wake up from your nap to eat something, and go back down from a nap. You didn't feel like that?
I think I did not allow myself to give in to it. Because of course, I do remember feeling tired, but I couldn't give in. I was drinking coffee. I know they say don't drink coffee, but I was drinking coffee 1 cup a day, at least.
Yeah,
I was
that's
having
fine.
1
cup a day.
Okay. But I didn't give into it. But yeah, I think that was one that I'm always tired anyway. I don't think I associated it with pregnancy because I'm tired all the time. But I was traveling for work and I couldn't really let myself feel tired. But yeah, I've heard that that's one that a lot of women experience. And I do remember feeling tired at times. I just didn't give into it. But that's one that's maybe one of the hardest because it's hard to function when sleeping. The other things are, kind of aesthetic, the looks, the way you look, and also the way you feel, which is sleepiness. But I feel like when you're tired, it's hard to function fully in the world. And then it also comes along with what they call brain fog. Is that a real thing, or is that just also a wives' tale?
People quote it as like mommy brain or
pregnancy brain.
Pregnancy brain.
Yeah.
I actually don't know the data on that, but it's something that I feel like a lot of women complain about or bring up in their pregnancies. I certainly feel like I've had it for sure, and I think it's carried on as a mother, but I don't know the data on it. Mm-hmm. Now, the crazy thing about it is, we just talked a lot about some things that happened in the first trimester, but it's always interesting to me because in our society here in the U.S., a lot of people wait until they're through the first trimester to even know that they're pregnant. And you're going through all these feelings and all these changes, and no one around you even really knows. Which I think is so crazy. So when you were, obviously I knew, and I'm sure you may have told some of your close friends that, but when you were kind of going through some of these changes in your body, what did you think? How did it feel? And what surprised you about it?
I was surprised by, of course, some of the discomfort feelings because I didn't know what to expect. When you're pregnant for the first time, it's hard to know exactly what to expect, even when you read books and you read blogs and talk to friends because you haven't gone through it yourself. So I was surprised by just the discomfort that I was feeling right away with the pain, the soreness, and some of the fatigue. But luckily for me, I did not have very difficult pregnancies. So for me, it was very mental. I was also in my head a bit and trying not to think about the pregnancy, especially with Dallas, because I had experienced a miscarriage. So I didn't really want to acknowledge and get excited about the pregnancy as much because I felt like, well, what if something goes wrong? And so I was okay with not telling people until the second trimester because I felt like, okay, once we get to the second trimester, we're going to be out of the woods. Everything will be fine with the baby. And so I was happy to just not talk about it, not think about it, because I wanted to have him grow and be healthier and bigger before spreading the news, just in case something goes wrong. I know that's kind of morbid and sad, but that was my reality. I just was like, let's get to this milestone of the second trimester, and then we can spread the word.
I think it's so interesting that you said that because I think a lot of women have that fear, which is probably why in our society we don't say anything until the second trimester. You know, miscarriage is so tough. And unfortunately, because of that, a lot of women go through it alone. And so that fear of, I don't want to disappoint myself or have something be wrong and then have it taken away kind of holds people back from saying anything.
Mm-hmm.
It's interesting because I actually had the opposite. With Jackson, I was kind of shouting it to the rooftops the minute I found out I was pregnant. But with Russell, I had tried for a year to get pregnant. The day I told you guys I was pregnant, I told my immediate family that I was pregnant, was the day I started having first trimester bleeding. And from there on, there was always some kind of weird complication. So I actually kind of held a lot of things close, didn't really tell people. And so by the time I delivered him 9 weeks early, some people were like, what, you were pregnant? So that's actually a little bit of a regret that I have because I was so nervous to like be 100% excited that I thought something was going to be wrong.
Right.
And that he came and people were like, oh, wait, what happened?
Right. Yeah.
But I get that feeling.
Mm-hmm. And also because for me, another reason was because I didn't want to say something to people, then have to go back and say something else, like heaven forbid something were to happen, then to say, oh, wait, now, you know, this thing happened. I have to explain and have all the condolences and have the spotlight on me. I was like, let me, you know, that was another reason I was like, I'm not going to say anything until the second trimester. And so you kind of do go through everything with your close circle and go through all those feelings. And so I actually was okay with that, going through things like, of course, telling you, mom, dad, our spouses. That was enough for me. I didn't feel like I needed the whole world to know until things were over that first trimester period.
Yeah. Now, second trimester to me is like, it's a weird time where sometimes you don't even realize you're pregnant. Like some of the first trimester symptoms go away. You don't have, for some women, you may not have the bad nausea, the fatigue kind of gets better, but yet you're not showing maybe, and you don't really feel movement. So there were times with Jackson that I was like, am I pregnant? Like, this is weird. And I was like, oh my goodness, is everything okay? Like my symptoms went away. Even though I tell patients all the time, like, don't worry, that's normal. But to feel it, it's like, whoa, are we sure everything's okay?
Yes.
Did you ever feel like that?
That is the weirdest thing about being pregnant before the baby starts moving, especially because the appointments are so spread out and you're not feeling any movement. You may or may not have symptoms. So you're like, is everything okay? Is the baby doing well? You just have to go on faith, basically, and the symptoms that you are having. That was my least favorite part about the first trimester, is just wondering what's going on in there. Is everything okay? I look forward to those appointments so much because I was like, oh, I get to finally see the baby. We get to do the ultrasound. I get to hear the heartbeat literally when you're in there. I just would like hold my breath, waiting till they show the baby on the monitor. Like, oh, there he is. All right, everything's cool. But yeah, that was very interesting. The second trimester is so awesome because you start to feel movement. For me, they started to feel like felt like bubble pops.
Yes.
A little bit.
Where were you for the first time that you felt movement with your kiddos?
I think it was at night when I was in bed, because that's when I'm not moving around as much. I'm more still. So I'm paying more attention to my body. So I'm pretty sure it was when I was in bed at home one evening.
I don't remember where I was with Russell, but for Jackson, I was with you doing wedding dress shopping the day you got your wedding dress. Oh my gosh.
Wow. But that's so sweet. Little Jackadoo.
I know. But that's always a fun feeling, to feel that movement and to be like, okay, this is real.
Yeah.
Yeah. I remember it was one of the first things I liked about being pregnant. To be honest, love the feeling of pregnancy as much as I thought I was going to love it, which I feel bad to say, but I romanticized it after taking care of pregnant women for so long. So to feel it, I was like, oh, what? I get heartburn and nausea and all
Mm.
this other stuff. Like, this doesn't really seem as fun as I thought. But once I started to feel the movement, oh, this is cool.
I actually didn't think you would want to have a second child because you didn't like pregnancy that much. I was surprised. I mean, I knew you wanted more children, but I didn't think that you would do it because you really didn't like being pregnant. So I was like, oh, okay, one and done. That's cool. But you did not like it at all.
Yeah, it's like a means to an end kind of thing for me. It's just,
Mm-hmm.
you know, it is an interesting feeling to see your body change so drastically. It's a thing that we say is like a beautiful thing, and our bodies were made for this, but it also is such a strange feeling to look in the mirror and be like, wow, I look so different. And there comes a point where you have this beautiful bump and you're like, wow, look at me. But there's almost like an awkward stage before that. For one, you may not be feeling that great, as we've mentioned already. But for me, at least, in the first and second trimester, and even up until the beginning of the third, like I don't show with a cute belly. I have wide hips. I'm achy. I can't sleep comfortably. Like it just a lot of things that are different than my norm. So it's something to get used to. So I didn't
Mm,
necessarily love it. I don't know. And
mm,
I didn't feel like there was a place for me to be able to verbalize that without people judging me. I felt like I would be judged to say that.
mm. Dang, that's rough because I wish that it would be more normalized for women to talk about pregnancy, giving birth, and pregnancy loss, just all the things that come along with bringing a life into this world.
Yeah.
Because it's just so common. A lot of the things you're sharing are probably very common, as you probably know because you work with pregnant women. But I'm opposite of you because I really enjoyed being pregnant. I what I did not like was the worry of, again, the anxiety that I shared in the previous episodes of something might go wrong. But I actually liked the changes that my body had because I didn't have too much discomfort. And I thought I just leaned into the way that I looked because again, I didn't gain a lot of weight. I didn't have skin issues. My hair was great. It was thick. It was luscious. My nails were growing really long. My eyebrows were finally thickening up. Everything was up on the up and up. I thought I was just like really, really cute. I loved the outfits. For me, I could wear my regular clothes well into the second trimester for most for both pregnancies. And so I was enjoying it. I really liked it. It wasn't until after the baby were delivered that I started to not like my body changes. But during the pregnancy, I felt like it all was kind of just par for the course. And I leaned into it because people were just, and also people are very nice to you when you're pregnant. They help you out, they
Oh, they
carry things for
do.
you.
Can I
They're
get the
super
door
nice.
for you? Oh, you have
Right.
to sit down. Don't carry that.
Right. Can I get you something? And I'm just like, yeah, please open the door. Yeah. Can you give me some water? I can't carry this. So, go with it.
That's so true. But I think there's something to be said about the fact that it is okay to love your baby, to love bringing children to this world, but not loving 100% every aspect of pregnancy. Or it is okay to have a really hard pregnancy and to verbalize that and for people to be like, oh, it's okay that you are verbalizing it's hard. What can we do to support you? Because some people have
Mm-hmm.
horrendously difficult pregnancies. I was not one of those people, luckily. But some people have nausea so bad they are hospitalized. Some people have such bad sciatica and round ligament pain that they need physical therapy. Some people have horrible insomnia that they're up all night and still have to go to work and still have to take care of other children. So pregnancy is hard, and it's more than just, your body's changing, but it's like it is physically and mentally tough.
Mm-hmm.
And we need to do a better job of supporting women through those moments and letting them talk about those things.
Mm. Yeah. And I'm so glad you brought that up about just the variation of the types of pregnancies that women experience because there's so much more than we talk about than we even hear, because I think it's also common for women to downplay how they're actually feeling in pregnancy, especially, you know, when you see a pregnant woman. It might be, if that's not a close friend or family member of yours, you ask her, oh, how you're doing, she's not going to tell you, oh, my sciatica is acting up, or I
Yeah.
can't keep a meal down. She's going to be like, oh, I'm doing fine. And then it's pretty much focused on whatever is the next topic of conversation, or also focused on the baby. You know, once you have the baby, now it's not about you anymore, about your pregnancy, it's about the child. So I love that you shared that, Renita, about um, us bringing this conversation to light so that women can feel comfortable really sharing how their pregnancy is truly going.
Yeah. Well, I think that one thing that's really key with pregnancy and kind of the changes in pregnancy, I would like to encourage women to do is focus on wellness in pregnancy. You know, in our last episode, we talked a little bit about postpartum moods and kind of preparing for those postpartum changes. But in the pregnancy, it's almost a year of your life, it's 10 months. And so, what are some things that you're going to do to help improve your wellness, your physical being, your mental being? And so, some of that is diet and exercise, and not diet and exercise for the of feeding the child in you, but almost like taking care of your well-being. I did not do those things as I probably should have in my pregnancy, but I really think it's important for women to do that. Now, when you were pregnant with both of the kiddos, did you do any specific dietary changes? You definitely probably exercised a little bit more than I did. What was kind of your routines with diet and exercise?
I didn't, well, with Dallas, I probably ate better during the pregnancy with both of them than I do now, because I was very intentional about wanting to have a balanced diet for the kids. And so it wasn't really about putting my wellness first for myself, but I was already starting to do what moms do all the time, putting your kids first. So I was already thinking about, okay, I need to have, a healthy breakfast, lunch, and dinner, a balanced meal so that they can get the nutrients. Especially with Dakota, also because I had gestational diabetes. So I was forced to have a healthy diet and maintain and keep my glucose levels in check. But I also was very active. I remember with Dallas, oh my gosh, I wish things were kind of like this. I was going to yoga. I was still going to LA Fitness, going to classes. I was walking. I went to like prenatal yoga and regular yoga. Oh man, it was great back then. Just so much time to do stuff and devote to work. But that was for my body as well as for the baby. I wanted to keep my body not even, I was going to say in shape, but I didn't do it for that. I kept it because I wanted to keep my body loose and limber and make time for myself and do something that I enjoyed. I still wanted to do things that were fun for me in that pregnancy. Did you have anything that you did to maintain wellness?
Well, I definitely think my naps. My naps were part of my wellness plan. I
Okay.
literally would just be so exhausted. I was like, listen, I need to go home and sleep. And that was a big part of wellness for me. I also think, if looking back, I really wish I had taken more time for exercise, but I really didn't. And part of it's because I was so tired, but just getting out and walking around the neighborhood, I think
Mm-hmm.
for me was how I can be as active as possible. Now, I work a job where I'm on my feet all day long and I'm running around the hospital, I'm running around the clinic. So sometimes when I get home, I'm already kind of exhausted. I just want to sit down. So I definitely get my steps in at work.
Mm-hmm.
But to be able to have like that leisurely kind of change of scenery outside of the house kind of thing was good for me. And I would try to walk outside with Jackson when I was pregnant the second time, around the neighborhood and around mom's neighborhood, who lives across the street.
But another thing I didn't mention was that I used to I took baths too. That was another relaxation technique. I did that for myself, and also I was also trying to get Dallas to rotate. He
Oh,
was
yes.
breech, didn't work, but baths were a great way for me to just, I would light candles. Sometimes I would go in there with a book or um with the iPad with a show, and that was a way to give back to myself. Also because I was having some swelling, and I was told that a bath maybe could help with that too.
Oh, yeah. Epsom salt baths are really good to help
Mm-hmm.
with swelling. But swelling can be just a part of pregnancy, especially in the third trimester.
Right.
But those baths can be really helpful if you have Epsom salt or compression stockings.
Mm. You know, one thing that happened with me in the third trimester was pain in my joints. My hip joints, like I felt like I could not get comfortable sleeping because when I would lay on my side, I felt like my hips were grinding. The joints were grinding when I walked. It was so uncomfortable. And it was so hard to get comfortable in that third trimester. Did you experience what type? I know you did, but what type of discomfort did you experience in the third
Yeah.
trimester?
Third trimester discomforts are real. So, you mentioning the joint discomforts, the pregnancy hormone that kind of sustains the pregnancy can also loosen some of your ligaments, kind of like in preparation for delivery. So, that progesterone can lead to some loosening. So, sometimes people can get achy joints, some popping, or feeling some instability or looseness in the joints. And I think that's what you were experiencing. For me, I was getting a lot of round ligament pain, some pulling kind of in the groin area. That's what they call round ligament pain. That was just very uncomfortable, especially when I was sleeping, and restless leg syndrome. Like every time I would lay down after a few minutes or close to an hour, one leg would be like tingling or falling asleep. So I had to switch
What?
sides. So all night long, I'm like switching positions because of this restless leg syndrome.
Oh my gosh. I never knew you had that. And I never understood what it was. I still don't really understand what it is. So it's a feeling of like your leg falling asleep and
It has
numbness.
that sensation, like it feels like it's just achy or it's tingly or like there's pins and needles in it. And so I can only lay on one side for a short amount of time before I have to switch sides. But by the time you're like full blown third trimester, it's so hard to switch sides. I used to have to
Yeah.
wake Bryson up every time and be like, time to flip me.
Wow.
Yeah, it was so uncomfortable, let alone the many times you have to get up in the middle of the night to go to the bathroom. Like
Yes.
that.
Yes. That I hated that. You could be in a good sleep. And I would try to sleep through it. Like I'll just hold it, but you can't hold it all
No.
night. But so I wanted to go back to round ligament pain because I think I had that, but I didn't have a name for it. Can you describe that again? Because I remember having pain in my inner thigh and it would be like a muscle spasm. And man, I hated that thing so much. It was so uncomfortable. I had it with Dakota at the end. It would just attack at random times. It just felt very painful. Is that round ligament pain?
So the way I describe round ligament pain is that the uterus sits in the middle of your pelvis, basically. There are these ligaments that hold it in place. And the round ligaments are at the front and they kind of go down into the groin. And as the uterus grows, they can get tugged and pulled on. Sometimes, if you change positions really quickly, they can get pulled on and it can lead to aching and cramping and just like a really uncomfortable area in your groin.
Okay.
People often get them in like the second trimester and on. You know, there can be a lot of different types of pain that you can get in pregnancy, unfortunately. Sometimes it can be due to like nerve discomfort. I think I mentioned sciatica a little while ago, that nerve that runs down basically your
Mm-hmm.
butt, that sometimes the weight of the pregnancy can kind of push on that. You know, there's all types of discomforts that you can really
Yes.
get. But I think it's great that you were doing yoga in your first pregnancy. And for women who do those kind of stretches and things like that, it can sometimes help to alleviate some of those discomforts.
Mm-hmm.
So,
Maybe
yeah.
that's why I didn't have any discomfort in that pregnancy. Whereas with Dakota, I was really didn't do anything. I was like committed to not working out, actually. I
Yeah.
wanted to just sit around. And so what you described is not what I had, but that was a pain. Maybe there is some medical name for that, but it would strike when I was walking upstairs
Was
or
it like a shooting kind of pain?
it was, yes, but it was in my inner thigh,
I don't know.
close to my groin.
I don't know. I remember there's this I don't know the medical term for it, but sometimes people get like a lightning crotch kind of pain.
Mm-hmm.
It's feels like
Is that a
lightning.
medical term?
No,
Lightning
it's not a
crotch?
medical term, but it's the term that I know other people have used. I
Yeah.
have used it myself, but I got it in the week before I had Jackson. It literally feels like lightning is shooting in the middle of my vagina, and
Mm.
that can be sometimes a sensation you get from pelvic pain. Like nerve pain in the vagina. Sometimes it's thought that it could be related to some cervical dilation or positioning a baby in the uterus, but I don't know the medical term for it. But that's again some kind of
Mm-hmm.
nerve discomfort that you can get. So maybe
Mm.
that's what you were getting, a little lightning rod.
Maybe it wasn't quite the crotch, but it was close. So, what about Since you talked about we talked about skin changes. Did you get stretch marks during your pregnancy?
Luckily, I did not. So obviously, it's different for everybody. I did not get stretch marks with either of the kids. I want to say I didn't because of genetics, but I'm sure that the lathering I did of my abdomen with all the lotions and oils didn't hurt.
Mm-hmm. Well, we are sisters and I got stretch marks. So your
Oh.
genetics must be a little bit better than mine. But no, I got it after the pregnancy. What's interesting, I did not get any during the pregnancy, but afterwards, I noticed them on my stomach after, not a lot. And I don't see them anymore, but I did see that after. But I do still have some, my back area, like your hip area, like where your butt meets, where my butt meets my back, if you can identify where that is. I have some stretch marks there, like the hip area. And that was never there before. So, which I found very interesting about, I don't know how stretch marks work, but I got them after my skin had
Now,
done all the stretching.
my understanding is that you can skip them in pregnancy while things are stretching, but you can also start to see them afterwards too, because their skin is making some changes as it shrinks back down. And
Mm-hmm.
also they change over time. So they may be more visible in the beginning and they
Oh,
lighten with time. They may not go away completely, but they can lighten a little bit. So that's probably why you're
mm-hmm.
starting to see some of those changes there.
Yeah. Okay. That makes sense. I hope that goes away too. Maybe that's one of the other discolorations that'll go away. So you also mentioned nerve pain. Something that I may have experienced that was related to nerve or maybe just discomfort from just being bigger is back pain. I had such
Oh,
a
yes.
hard time getting comfortable sitting at my chair at work. Oh my goodness. It was so hard to get comfortable, especially the third trimester. I would be piling the pillows on. I had to get up and walk around, find different places in the house to work. Back pain for me in that third trimester was just so uncomfortable. Is that
Now,
pretty common?
that's really common. And I really think I had some good techniques that I personally used to help me with back pain because it was really unbearable the first pregnancy since I got all the way through the third trimester. Using pillows behind me at work in my
Mhm.
seat to make sure that I had good lumbar support was helpful. I also, in addition to doing those bubble baths at night that you mentioned, I would put heating pads on my back at night to help a little bit. And
Mhm.
then at night, the way I slept, I had to put extra pillow support in my back to make sure that I had good support with sleep too. Something I usually recommend to patients who have like pregnancy related back pain or even pelvic pain is using a pregnancy belt or an abdominal girdle is another term for it, but it
Mm.
can support the uterus a little bit more to take some relief off the back muscles. So those are some other techniques too.
Oh wow. Hmm.
Yeah. Now, we can't get away with talking about pregnancy bodies without talking about weight gain. Now, I am somebody who is always over the recommended weight gain in pregnancy. And it can be hard and it can be like a lot of pressure for sure. When you see your healthcare provider, your OB, your midwife, they probably talk to you a little bit about what's recommended in weight gain. The Institute of Medicine, they provide these recommendations based on what your starting weight is. But somebody who's normal weight, usually they recommend about a 25 to 35-pound weight gain over the entirety of the pregnancy. So for me, I probably gained like 40 pounds with both of my kids. And that includes Russell, who was born 9 weeks early. I was 40 pounds by the time he was born. So who knows what it would have been if I'd gotten all the way. So I know that it can be very tough when it comes to weight gain and a lot of pressure. But I think the key that I would recommend to women is really just to focus on overall health rather than a number on a scale. And part of what can play a role is what you eat, like knowing that you don't need to eat for two, but just adding an extra 300 calories to your diet a day. So with your diet, Christy, like you ate very different than when you're not pregnant, or did cravings play a role in the kind of foods that you were eating?
Well, naturally, I think I have a healthy palate. I do, like you guys always say, you and mom always say, I eat weird
Yes, you do.
because I like to eat, I don't know, kale chips. But I gained about 25 pounds with each pregnancy. And I did have cravings. I totally had cravings and I would give in to them. I'd say, hey, Dontrell, can you go get me some chips? I really loved sour candy. I loved sour Skittles with Dallas, and with Dakota it was those sour belts, and I don't eat like that normally. I
That's
never
so
just
funny. That's like my go-to thing that I love when I'm not pregnant.
I know. I tried them when I was pregnant with Dakota, and I was like, oh, these are good. And I kept eating them. They were really, really good. Because I used to get sour belts and I started the straws. But yeah, so I definitely had cravings, but that was unique to the pregnancy. I did it, but I did not overdo it because I don't know, I just felt like, I guess I had good self control. I did. And I also think I'm lazy. I didn't want to go to the store a lot. I just, what do we have in the house to munch on? So, and like you're saying, Renea, I think genetics has a part to play in it as far as your weight gain, because I'm sure if we did a review of what we ate in a day, we probably were eating very similar. I don't think that you eat large portions. So the reason that you gain 40 pounds and I get 25 pounds maybe has to do with something more than just what you ate. Did you think that you ate more during pregnancy than normal?
No, not at all. I mean, I definitely know my appetite's probably higher when I'm pregnant, but I don't feel like I ate a lot more. And every single time that I would, go to my appointments and I look at the weight, I'm like, wow, here we go. Like, I don't know what I'm doing. I don't know what I'm eating. So I really want to stress out there to everyone in the world listening that, don't beat yourself up too bad about your weight. Yes, it's important and we want to make sure that you're healthy and everything like that. But some things are more than what you eat and what you exercise. Do your part, but don't feel 100% bad if you aren't hitting exactly the numbers that are always recommended, because it's more complicated than you may think. That is how I felt when I was going in, like, gosh, if only I could get this number on the scale how it's supposed to be. But I just know that everyone's body is so different.
Mm-hmm. Yeah, I tried not to care about that because I knew that once I had the baby, things would change. Again, things are going to change. My weight might be this today, but once the baby comes, it'll be something else, which I was even more surprised by how the weight didn't just fall off. But can you tell us what is the breakdown of numbers when it comes to weight gain? Like what is weighing in your body, the baby, the blood, the this, that?
So a rough estimate, I would say, is you're not just thinking about your weight, but you're thinking about how much blood is in your body, because that doubles in preparation for the blood loss of delivery. The placenta in itself, which is going to have its own amount of weight when it's born. You've got a probably 6 to 8 pound baby in you. Your breast tissue, as it's getting enlarged, the ducts are filling with milk. That's weight in itself. So there's a lot of things that go into play in addition to just your actual increased fat cells, so to speak. And so all of that plays a role when you're thinking about weight gain in pregnancy.
So when they say eat for two, or I know that's not true,
Do
but
not eat for two.
well, when you're supposed to eat more calories, is that just to provide additional nutrients to the
Yeah,
pregnancy and to the
basically,
mom too?
you want to increase the nutrients that you're providing to the growing baby. So by increasing about 300 calories a day for somebody who has a singleton pregnancy, just one baby in them, you're ultimately providing nourishment to that baby, the vitamins and the minerals and all the things that you pass over, the proteins, the carbohydrates, all that's going to you and baby. And so you don't necessarily need to eat double, but you do want to increase your amount of food each day in order to do that. So what I usually recommend to my patients is, instead of counting carbs and counting calories, more so looking at what your meal intake looks like. So rather than eating just a breakfast, lunch, and dinner, it might be better to increase snacks throughout the day, like a mid-morning snack, a mid-afternoon snack, add an extra side to your meals, and then all the while trying to make sure that you introduce what we would say is a wholesome meal with fruits, vegetables, good healthy fats, and things like that to your diet.
Mm-hmm. Okay. I I could see that. So those sour straws can fit in there somewhere. Maybe not in the pyramid, but they could fit in somewhere.
A little treat, a little cherry on top.
Right.
Well, one thing I wanted to talk about was, how did you feel people perceived your body in pregnancy? You mentioned that people were like, oh, I can do this for you. I can do that for you. Let me open this door because you're pregnant. But did you ever feel like people stared at you in pregnancy or people had comments about your body as a pregnant woman?
Of course, people can be rude and also say what's on their mind in a very nice way also. But to me, the thing that stood out the most was how sometimes people would view your pregnancy as like a disability. Like you can't do things because you're pregnant. And I particularly think about work and even the well-intentioned like family and friends. So at work saying, "Oh, Christine, and this could be good." Some people might be like, "Yeah, I don't have to work as much." I was traveling for work, but after a certain point, they stopped asking me to travel because they were like, "Oh, you're pregnant. You don't need to come. You don't need to go." And I'm like, "I'm pregnant. I'm not, you know, bedbound. I can still move around." But they told me, and not like they did not say don't travel, but they asked me, "Do you still want to travel?" And I did say no. So let me, change that around. They didn't just say, don't get on this plane. But I felt like that was an assumption, or maybe it was a courtesy. But I do feel like sometimes people have this assumption that pregnant women can't do certain things because they're pregnant. And yes, we are limited in certain ways, but not necessarily. I think back to like hundreds of years ago, pregnant women just doing everything while pregnant, even athletes. I think there was an athlete that ran in the Olympics while pregnant. I feel like that was something that stood out to me was the fact that people would say, "Oh, don't do that. Don't, you can't pick this up or you can't help me with this because you're pregnant." And I'm somebody that likes to do everything and kind of has a take charge attitude. So I personally could be offended when people are telling me not to do things because I'm pregnant.
That is so interesting. Like, I've heard so many people say all these, old wives' tales, like don't lift your hands above your head because the umbilical cord's going to get wrapped around the baby's neck, or you can't bend over. Like all these interesting thoughts.
Yes.
But that's true. Like you can, it's not a disability. You can do what you really feel comfortable doing.
Like, remember when we were moving some stuff out of a storage unit and you were pregnant and you were lifting a lot of things?
Yes, and all y'all were like, "Sit down, sit down."
Right. I was doing
I was 8 weeks pregnant, literally, like just barely pregnant.
But that's an example of that. It's like, "Oh, don't lift that. You could lift a lamp and carry it to the car," but that's how we perceive pregnant women of like having this disability. If you don't do that. And I think, of course, it is well-intentioned. We don't want the woman to harm herself or the baby, but I do think women are stronger than maybe is perceived. And I think you're even more strong in pregnancy.
It's also an interesting thought, just hearing you say this, that sometimes in pregnancy, people treat pregnant women with delicate gloves, like, "Oh, be careful, don't do this, don't do that. We need to take care of this pregnant woman." But then immediately postpartum, it's like, "Okay, back to work. You got this." And we have the shortest leave ever for maternity leave. But that's a whole nother conversation.
Mm-hmm. What about you? Did you, the same question you asked me about how you feel like people perceived you during pregnancy?
Yes, I think for me, so I heard a lot about my look in pregnancy. Like people just would comment about it all the time, which could be good and which could be bad. Like I would hear so much like, "Wow, you really look pregnant. Oh, wow, how far along are you? You look like you're almost about to pop." Like, all those kind of things.
Mm-hmm.
Just like, yeah, no, I'm not almost about to pop. Or like people feeling like they can touch you in pregnancy. Like they just go straight to touch your stomach. And that too is a bit interesting.
Yes.
So
yeah. Well, you already know how I feel about people commenting on a woman's body, but a pregnant woman's body, it's just so bizarre. I'm not on display at the zoo for you to just comment on. But again, it's the whole thing about intentionality and what is meant. I think that pregnancy is just so joyful, not only for the mom to be, but also people around you tend to kind of get into the happiness when they see a pregnant woman. It just changes the mood a little bit in a positive way. So I think a lot of when people are commenting or saying something, it's like, "Oh, you're pregnant? How exciting." Because it's not every day you see a pregnant woman. So if you see a pregnant woman, you want to say something about it because it's exciting for you in that moment to kind of be in close quarters with a pregnant woman. I mean, honestly, I don't know the last time I saw a pregnant woman. And when I see one, I probably stare. I'm like, "Ooh, is she pregnant?"
That's part of the reason why I just adore my job, because it's almost like being around people at most exciting times of their lives, because it's a time of hope, something to look forward to, something that will bring you joy. Even if you're not joyful in the moment or if some hard times are happening, it's a light coming soon if it's not already there, because you have a new life coming into the world. So I just love working with pregnant women every day.
Oh my gosh, I know. It's just such a joyful time. Even if your pregnancy is difficult and you're going experiencing some of these things we talked about, it is such a hopeful and joyful time because it's the hope of the unknown and the potential of what can be and your future. And it's just so joyful because I never foresee women. I don't think women, maybe you have experiences too, like thinking negatively about what will happen when this life comes into the world. There's always something positive to think about when you're bringing a life into the world.
Yeah.
It's now time for rapid fire, where we answer questions related to the topic of the day. All right, Renita, very first question is, what is your favorite clothing brand for pregnancy?
I don't really have a clothing brand that I went to all the time, but I really wanted a good supportive bra, and Target had some really good bras. So Target maternity bras, but also Calvin Klein maternity bras were so comfortable.
Yeah, I had their underwear and I did have Target bras too. They have a really great selection and it's pretty affordable. I loved ASOS, which I discovered during my pregnancy with Dakota. They were so cute. They have a really lovely maternity selection of cute clothes, and it gets there within just a couple of hours. Well, not hours, 48 hours or less, but really, really cute.
Ooh.
Next, what is your must-have skincare product during pregnancy?
I would say there are two for me. One is that I use a body oil all over my stomach and my thighs. It's called Bio Oil, and I really love it. It smells so good, from Target. And then the other thing is, I'd mentioned earlier that I get acne, especially in the pregnancy. So I was using azelaic acid, which you can put on your acne parts or your face. And I got mine from The Ordinary. So those are my two.
I love The Ordinary for just all around skincare products. For me, it was Burt's Bees Belly Butter. My husband got that for me. He would always re-up every time it went out, and it really, really felt very good going on.
Ooh.
What's your biggest pregnancy craving?
Oh my gosh. I think it was different in each pregnancy. So in the first pregnancy, it was soup randomly, but I wanted any kind of soup I can get my hands on. And in the second pregnancy, again, super weird, but it was salad. Any kind of salad. I was eating so much salad. That's such a weird thing.
That is a very weird craving. Oh my gosh. For me, it was sweets. I am not a sweets eater. I would never just go to the store and get a candy bar or anything like that. I never just go out and get sweets. But when I'm pregnant, I am craving sweets. I will go and get a chocolate bar, some sour straws, some Skittles, and I never do that. So I know for a fact that that's one of my pregnancy cravings. What's your favorite body part during pregnancy?
Ooh, I would say my boobs. They get so full and perky. So it definitely has to be my boobs.
That is, I think that many women probably feel the same way. For me, it is, I love my hair during pregnancy because of the fullness of it. It's just like never before. It really, I've always, like back in the day, we used to get perms. I'd be like, my hair is so thin. Of course, I'm natural now. I don't have that issue. But during pregnancy, so lush, so shiny, so full. I know, I mean, technically it is a part of my body. So I think it counts.
Oh, yeah, for sure. And I love how long my hair gets when I'm pregnant. Oof.
It's
but
so
yeah, still my
beautiful.
boobs.
Do you have a favorite prenatal vitamin brand?
No, I do not. In fact, my whole pregnancy, I just took a different sample from my office or over the counter. I would just get something there. So there's not a particular brand that I personally use or that I recommend, just one that you want to use.
Yeah, true that. I like Rainbow Light Prenatal 1. And there's really no particular reason I like it. I think one reason that attracted me to it was because it said organic. It had the DHA recommendation on it, and it had a very nice packaging, which attracted me to it also. But other than that, I don't really know the difference between that and other brands, probably very similar, but I just used it. What's your favorite part of being pregnant?
Mm-hmm. Number one, and there's only a couple, but number one is feeling the baby move inside of you. Like hands down, the best part of being pregnant.
Oh, that is such a special feeling. For me, my most favorite part of being pregnant is the way people treat you. I feel like, I mean, there's a lot of favorites, but that's one that stands out to me because people can be so kind. They allow you so many graces. They're so nice to you in public, and they treat you like they just treat you like just so much kinder. So I really appreciate all the kindness I get from people when I'm pregnant.
That is so true. Yes.
What is the craziest thing someone said to you while pregnant?
Oh my gosh. So many crazy things. Saying to me, how far along are you? You look like you're almost due, when I'm nowhere near being ready to have a baby. That's probably the most annoying of all the things, just making assumptions about when I'm actually going to have the baby.
Yeah. That is like, how would you know by looking? You just can't tell.
Yeah.
Something annoying people say to me is, and I think I spoke about this earlier, it kind of goes back to the people I love so much can also be very annoying, but the limiting language that they say, oh, you can't do this, you can't do that. It's really not anything crazy. I don't really have any crazy stories of someone saying something outlandish, but it's some of the limiting talk that you hear when you're pregnant. I think that to me is crazy. It's like, oh, you can't lift that. You can't fly. You can't, some things that aren't medically backed.
I think overall, the craziest thing to me is that people feel like they can voice their opinion about your body when you're pregnant in a way that they wouldn't if you weren't pregnant. So being able to say, yeah, you shouldn't be doing that, or you need to sit down, or even saying you look a certain way, people would never, well, I can't say never, but they would be less often to do that if you're not pregnant.
Yeah, because they probably don't know. They don't know.
Yeah.
What is the item that brought you the most comfort during pregnancy?
Probably I would say my maternity pillow. So sleeping with that thing wrapped around me, I had a love-hate relationship with it because sometimes I felt like trapped inside of it, but it was just really comfortable to be able to like hold on to it and just lay on it in a position that made me feel the most comfortable after being at work and having to stand all day or sit in an uncomfortable chair. So it would be my pregnancy pillow.
Yes. I too love the pregnancy pillow, and it's so comfortable. My first pregnancy, I had one that it was more like an S shape. You remember we both shared it.
Well, yeah, it was mine. And
it was that S shape one. Well, you have it now because then I ended up buying my own. Yeah. And I got one that wrapped your entire body. So it went all the way around like a U. That one I loved. It was like a hug in the front of your body and the hug in the back. My husband used to call it my husband. He's like, that's your husband. That thing was between us for 9 months straight. I think the minute I found out I was pregnant, I was like, oh, pregnancy pillow. Bought it right away. Didn't even need it yet, but it was just so comfortable. Gosh. That thing is awesome. I'll try to find it and put it in the show notes because it is incredible. Needed. And the last question is, what is the best sleeping tip that you have for pregnant moms?
Okay, so my tip is tips on how to wake up and get back to sleep as easily as you can, because as you know, you have to get up all the time to go to the restroom. So I used to be really in the bathroom all the time, and then waking up, turning light on was too much and it was hard to get to sleep. So I literally would track my path so that I didn't have to open my eyes. I knew exactly the path to get to the bathroom, didn't have to turn on any lights, go to the bathroom, get back, and get in bed without opening my eyes, turning on the lights, hitting anything. So that's my tip. Find a way to get to the bathroom and back as quickly as possible with no lights, and maybe with your eyes closed if you're good at it.
And no obstacles in your way. Hopefully you don't have a dog that's lying there, a cat or anything like that. The best sleeping tip for me is to find something that makes you comfortable in your sleep, especially as you get farther in pregnancy. So be it a pregnancy pillow or just a stack of pillows that you have, heating pad, anything to make you comfortable, because you are going to have to get up. That's inevitable. But at least when you're lying down, you'll be comfortable.
Oh, yeah. So I want to end it with this. When you were about to give birth to your babies, what was the one thing that you were thinking you were going to miss about being pregnant? What's the one thing that you're like, goodness, this is my favorite thing. I'm going to miss this.
I know that I was going to miss being pregnant. I know that sounds very general, but I was going to miss having the baby, carrying my child. I'll be more specific. I was going to miss carrying my child because I really enjoyed rubbing my belly at night. Whenever I think about being pregnant, I think about laying in bed at night with my baby, just me and the baby. I felt so connected to the baby when I was alone, because feeling the kicking and knowing that I'm doing this really important thing in nurturing the baby without even lifting a finger, I knew I was going to miss that intimacy of carrying my child, because I just think it's so miraculous and wonderful to be able to do that. And so I knew that I was going to miss those quiet moments of me just thinking about, wondering, what is it going to be like? How is this going to be? Because once they're here, they're here. But it's that wonder and awe in those moments of like, oh, this is going to be so awesome. So I said a lot, but I was really going to miss just having the child, just carrying the child.
Yeah.
What about you?
I think back to when I was pregnant with both of them, but vividly in my head, Jackson, I have a type of job where I might have to leave in the middle of the night to go deliver a baby or what have you. And I remember those moments when I would be in the car driving to the hospital, or like in the hospital waiting on somebody to have their baby. And I felt like it was just me and Jackson, or me and Russell, like just me and them in that moment. And I would just be like, hey, baby, you're here with me. Like, you just have this connection. They'd kick and I'd be like, oh, there you are. And I just feel like I'm having an internal conversation just in those quiet moments. So I knew that when they were born, we have a whole journey of life together moving forward. But that kind of moment, that kind of connection where it was just me and him, is now going to be over. And now it's like us and our whole family. But that was like those little moments that I love the most.
It is such a personal connection, because it is you and the baby. It's just you and that baby inside of you. Nobody else knows what you're thinking, what you're going through. But in my mind, the baby knows. The baby's there with me. And it's just so special. I'm glad.
So special.
I'm glad we're ending on this note, because it's just such a lovely, lovely thing. And no matter the circumstance of your pregnancy, that internal moments with your child is just, it's priceless. It's truly priceless.
Worth all of it. It's worth all of it, I would say.
Mm-hmm.
Yeah. All right, you guys. Well, thanks for joining us again for another episode of Cradle and All. And we'll catch you back in 2 weeks. So see you then.
See ya.
Don't forget to subscribe to our podcast so you don't miss a thing. And leave us a review. You can also follow us on Instagram at The Cradle and All, or email us at thecradleandall@gmail.com.